Is sigmoidoscopy covered by health insurance? If you're wondering whether a sigmoidoscopy is covered by your health insurance, you're not alone. Many people want to know if this important screening test is included in their benefits. A flexible sigmoidoscopy is a procedure used to examine the lower part of the colon, specifically the sigmoid colon and rectum. It is a key tool in colorectal cancer prevention and screening. Federal laws, such as the Affordable Care Act, requiring that private insurance plans and Medicare cover colorectal cancer screening tests recommended by the U.S. Preventive Services Task Force. This includes flexible sigmoidoscopy when done for screening purposes. When performed as a screening test, these procedures are typically covered without patient cost-sharing, meaning no co-pays or deductibles. Medicare generally covers flexible sigmoidoscopy for colorectal cancer screening once every 4 to 10 years, depending on individual risk factors and prior screening history. For example, Medicare covers a sigmoidoscopy every 10 years for average-risk adults aged 45 and older. If polyps are found and removed during the procedure, patients might owe co-insurance, but the screening itself is often fully covered. Private insurance plans usually follow similar guidelines, often covering sigmoidoscopy every 4 to 5 years starting at age 54, those at average risk. Coverage details can vary between plans, but most include sigmoidoscopy as a lower-cost alternative to colonoscopy for colorectal cancer screening. People with higher risk factors, such as a family history of colorectal cancer or genetic predispositions, may be eligible for more frequent screenings. Coverage for these cases depends on medical necessity and individual insurer policies. It's important to note that if a sigmoidoscopy is performed for diagnostic reasons, such as investigating symptoms or following up on abnormal test results, coverage and costs may differ. Additionally, if a biopsy or polyp removal occurs during the procedure, billing may change, and some patient costs could apply. In summary, most health insurance plans, including Medicare and private insurers, cover flexible sigmoidoscopy when used appropriately for screening. This coverage supports early detection and prevention of colorectal cancer, aligning with established medical guidelines. To be sure about your specific coverage, it's best to check with your insurance provider and discuss your screening options with your healthcare professional. Remember, regular screening can save lives by catching issues early when they are most treatable.